After your valve procedure to treat your aortic stenosis, your focus should be on recovering and working with your doctor and heart team on an individualized plan to get back to an active life. Your heart valve procedure is a pivotal step in your AS treatment journey, but your recovery process is just as important. You might have a lot of questions about how you will feel once you return home. Most patients gradually feel better over time, with improvement each day that goes by. Depending on the type of treatment you receive, recovery time back to normal activity can vary from as little as a few days for those who receive TAVR to a few months for patients who undergo open heart surgery. Depending on your treatment, your doctor will prepare you for other things you may experience during the recovery journey. Remember, this is a gradual process, and every patient is different. You may have to make minor lifestyle changes as you recover. Your doctor will help you determine what is best and safe for you at this time, like eating heart-healthy foods. Additionally, a referral for cardiac rehab may be recommended to support the recovery process. If you had open heart surgery, you may also need to take additional hygiene measures to prevent infection at your incision site. Follow-up care with your doctor is also key to maintaining your heart health post-procedure. Be sure to return to the valve clinic for appointments to have your heart valve checked. These generally occur 30 days and 1 year after your procedure, or as your doctor sees fit based on your treatment. At these appointments, your doctor will monitor your progress, and you will have the chance to discuss your lifestyle and medications. If you have concerns before your scheduled visits, don't wait. Let your doctor know right away. Talk to your dentist and other doctors so that they can take extra measures during cleanings and procedures to avoid causing infections in your heart valve. Now that you are in recovery, you've made it through each stop in your AS journey and are on your way back to a healthier, active life. Most importantly, you have a working heart valve. Visit HeartValveSurgery.com to learn more and access additional resources.